this is the best place, and I want to retire here. So it's a very family-oriented unit.
And we're like, one big family here.
It very much has a feel of a family.
Honestly, the one thing that I say when I talk to people when they say, how do you like working at St. Mike's? How do you like working in the NICU? I said, the number one thing that I love is that we're a team.
I've worked in a few areas in the hospital. Overall, I love St. Michael's, but I have to say the experience in pediatrics or our NICU is probably the most rewarding that I've had so far as a dietitian.
For any of the patients in the unit, we do have a very interdisciplinary approach to the care. It's never just one doctor kind of dictating everything. They always look to the nurses, to the nurse practitioners for their advice on how the care has been going and what things should be changed.
The feeling that you get here at St. Michael's Hospital is very different, and the families that we care for, I think, notice that. They gravitate towards us. I think they very much experience the care that we give in a way that identifies us as an inner city hospital with a focus on the urban family.
St. Michael's Hospital has a unique place in that at the same time it is a tertiary care academic hospital, it also services a local community.
Generally, I think our deliveries are roughly around 3,000 plus over here. We have always have some 18 to 17, 18 patients all the time. We have a very strong fetal medicine unit as well. So that's why we see a lot of babies who are really sick.
I think the NICU at St. Mike's is integral to the care of hospitalized infants, both for those who are born prematurely as well as others that might have medical complications, ensuring that all of the needs of the children and family are being met.
There's always advancements in neonatology, in medicine. Like every day something's being discovered, and definitely we could use a ton of equipment.
There's always stuff that's needed. A lot of the equipment that we're using is quite old and outdated, so having new equipment or even just getting more of things that we already have but we have limited supply of would go a long way to helping us care better for the patient.
A state-of-the-art incubator is about the cost of a small condo in downtown Toronto, right? And they're very nice condos too, but imagine needing 20 of those for the NICU. The monitoring equipment is extraordinarily tech-heavy and very, very expensive.
Fundraising has become a necessity in this time of government restraints and controls and restrictions.
You know, whether the funding comes from ministry dollars, foundation dollars, private donors, it's extraordinarily important for the running of any intensive care unit.
It's become a necessity both in program development and expansion, as well as supporting educational research activities.
I think that when your patients are someone like a 32-week baby, you get a lot of satisfaction out of coming into work every day and just seeing them grow, see them develop, and then see them get to go home doing so well.
It feels really good, like you've really accomplished something, that not only have you been able to care for the baby and bring the baby to the point where they're ready to be discharged, but that you've got those parents also to feel comfortable enough to have those babies at home and feel completely confident that they're able to care for them.
The day-to-day work of taking care of premature babies, there's very few moments in life where you have that ability to impact somebody's future. It means there's something about a delivery, the birth of a new child, that is magical to begin with. And although nobody wants a baby to be born prematurely or to be sick, the chance to impact on that, to help that baby transition, to stabilize them, to quote unquote save them, is a huge privilege, and I wouldn't trade that for anything in the world.